So we're talking to Scott Rich. He is Growth and Marketing Director for Practice Greenhealth. Now, Rich, tell us, what is Practice Greenhealth?
Practice Greenhealth is the largest nonprofit organization working with hospitals and health systems around sustainability and climate change. And our main role is to help our hospitals and provide the resources and tools they need to create those strategies and operational efficiencies in their own hospitals.
Can you give us an example of what that would be?
So for example, hospitals will join Practice Greenhealth, and we have a suite of tools and resources available to them. For example, if a hospital is looking at its to try to do some waste reduction strategies. As we all know, hospitals have a big footprint when it comes to lots of areas, from energy to waste to a lot of things. And so if a hospital is really trying to reduce its waste footprint, meaning they want to divert a lot of waste that's going to the landfill, they want to try to recycle more, they want to try to reduce the amount of product packaging that's coming in through materials management in their supply chain, we have some toolkits and resources that'll help them kind of figure that out, whether it's strategies to implement in their own hospital or utilizing a sustainable purchasing guide so that they have the tools to work with their supply chain partners, and just ways to be more efficient and recycle and reduce their impact.
So I was looking over some of your website. Found it interesting, the one statistic that stood out. Hospitals generate over 29 pounds of waste per bed per day.
Mm-hmm.
Is that just overall waste, or is it specific?
Yeah, there's a bunch of different kinds of waste in hospitals. That's the interesting thing about just a regular office building. Probably has maybe just a couple of categories of waste. They may have solid waste and then maybe paper waste. Or hospitals are a little different though. We've got HIPAA waste, right? That's got specific patient information that has to be disposed of in a certain way. We've got red bag waste, which is medical waste. We've got hazardous waste, if you think of chemotherapy and other kind of chemicals that we need for certain things. We've got pharmaceutical waste. And then we've got all the other regular waste, the stuff that goes in the waste basket. If we're doing some kind of a construction project or remodel, we've got construction waste, like others. But we have about 5 or 6 different categories of waste in a hospital setting, and they each require different methods and procedures in order to process that waste. But there's also best practices around how to reduce about the shortages of PPE. And so part of that is the gowns and the protective equipment that our hospital first responders and first line professionals wear. A lot of those are single-use disposable. But we have a lot of our hospitals out there that do reusable isolation gowns and reusable PPE. And so those gowns are then taken to laundry. And so they get to use those time after time. Now that creates another kind of impact because there's more water being used, but you kind of have to weigh what's going to the landfill, and you know, a lot of those gowns, those disposable gowns, are made of plastic, and we all know about the harms of plastic. So yeah, there's a lot of waste, a lot of different strategies that a hospital can take. The other thing too around waste is around education too, educating the hospital employees not to put certain types of waste in the red bags, because red bag waste is 5 times more expensive than the regular type of waste that goes to the landfill. So if people are, you know, in the nurse's station are putting pizza boxes in the red bag waste instead of in their proper place, that's going to be 2 or 5 times more expensive for the hospital to dispose of that instead of segregating the waste. And so there's a lot of education that goes into that too.
You mentioned water. Is it just reducing the use of water, or is there ways that you help hospitals better, I guess, reuse their water? Does that make sense of what I'm trying to get to?
Yeah, I think in any sort of resource that we have, whether it's personal in our own homes or whether it's in our place of businesses or certainly hospitals, any sort of resource that we use, we want to try to use it in an environmentally friendly way, and conserve our resources. We, you know, Pacific Northwest, we always think because it's rainy most of the time, 9 months of the year it seems, that we have a lot of rain. But Washington State and Oregon, where I am based, we're in a drought right now. And even though many of us live close to water sources, the ability to have fresh water and drinking water all the time isn't guaranteed. So just being a good steward of our water resources and not wasting those resources is really important. And also how we get that water. Is it a process where the water is continually being left on all the time in certain situations, whether that's in a lab function or in others? Do we provide bottled water for our employees that has another waste component to it? Because now we've got plastic. So there's different ways to think about that. But yeah, I think there's a lot of different strategies that we try to help hospitals implement when it comes to all of our resources.
You have a topic on your website that says greening the OR. So
Yeah.
How do you green an operating room?
Well, I wish it was as simple as just taking a can of green paint in there and slapping it on the walls. But greening the OR obviously refers to making our operating rooms and our surgical suites more sustainable and more environmentally friendly. Probably the biggest amount of email and requests that we get at Practice Greenhealth and Healthcare Without Harm comes from the greening the OR. It's usually an operating room nurse or an anesthesiologist or surgical technologist, somebody like that, saying, I work in the surgery center or the operating suite at XYZ hospital, and I just see so much waste from the blue wrap that a lot of the equipment and tools and stuff is wrapped in, that just you unwrap it, you take your tools, and then you throw away that blue wrap. Why are we wrapping it in blue wrap? There's a lot of waste with regards to energy. Most operating rooms have to be set at a certain temperature. But a lot of hospitals leave that temperature on 24 hours a day, even though they might not be utilizing those. So is there a way that we can kind of put some smart technology, smart thermostats on those, hospital room suites or surgical suites to reduce energy? And we turn off all the monitors in those suites and in areas. So there's a lot of waste being generated in an operating room. And so it became such a big deal, and operating rooms kind of are their own beast because they're a part of the hospital that require all the different lines to be working all the time, right? Because you've got the patient on the table. It required a special program. And so we developed that Greening the OR program. We also recognized that there was so much waste and so many opportunities for reducing waste and just environmental stewardship in general in the operating room. That was a great program to start because the hospitals could see some wins, if you will, around sustainable practice, and then they were able to kind of translate some of those best practices throughout the other areas of the hospital.
I was going to ask you about food. What are the steps that can be taken to reduce the waste, or what are we talking about when we talk about food?
Yeah, there's a great question. There's a lot of things in food. We've got a really active food team that works. When you talk about food in a healthcare setting, there's a lot of different things to consider. So everything from the type of food that we get, are we getting it shipped to us from across the country, or are we using local sourcing where we're reducing that carbon footprint and at the same time supporting our local communities and our local businesses and our local economies? Many times, our hospitals use a food management service, and their food comes from a can, and it's coming from Kansas. No offense to Kansas, but if we can get more fresh fruits and vegetables, that's helpful. If we can reduce meat, meat and protein is very expensive, or it's more expensive. So if we can have a more plant-forward menu, that's been deemed by most all registered dietitians as a more healthy menu for not only our patients, but our employees as well. And if our goal is to create a more healthy community, that includes our own employees. So that's an area. And then what do we do with the food that we produce in the cafeteria that's not used? Are we composting it? Are we sending it to the landfill? Or are there ways that we can save some of that food that's perfectly good and give it to people that might be at risk in our community that are undernourished and have hunger issues? So I think there's a lot of different things when it comes to food. Packaging is also a big deal with food too, because the food comes in and it's prepared by our food nutrition services, but is it coming in cardboard? What kind of everything we bring into the hospital has to go out in some way. And so if we can reduce what's coming in, especially on the packaging, then we've kind of reduced that footprint going out too.
When you talk about chemicals and drugs and things like that, how do you suggest handling them?
Well, I am definitely not an expert in that, but luckily the hospital and the health system in the United States is very highly regulated. So the EPA and other state agencies have has to be disposed of in a certain way, and there's guidelines that are provided by the EPA on how pharmaceutical waste is disposed of. You can't just throw it down a drain that ends up going into our water supply system, and then we've got drugs in our water supply system, right? So it has to be done in a proper way. And again, that's another resource that Practice Greenhealth provides. So when we have timely updates on new regulations and guidance like that, we always have webinars and education series to inform all of our Practice Greenhealth Network partners on what the latest and greatest regulations are, and how we can help them be sustainable and be compliant.
Well, how many hospitals are currently utilizing your services?
We have over 1,100 hospitals in the US and Canada. I'm mainly responsible for the US and Canada. We have a whole bunch of other hospitals that are more global hospitals, but they fall under a different network. It's called Global Green for Healthy Hospitals, which is part of Healthcare Without Harm, our sister organization. But we have over 1,100 hospitals. Some of those hospitals are standalone hospitals like Mason General. Some of them are part of larger health systems. But yeah, they come in all shapes and sizes, critical access to rural, urban hospitals, academic medical centers, teaching hospitals, you name it. We've got, level 1 trauma, and we got little small hospitals or clinics as well. We've recently also added our partnership availability to ambulatory surgical centers, community health centers, and then just recently in the last month have invited other types of healthcare sector businesses. So companies out there that supply equipment to our hospitals, that supply medical supplies, pharmaceuticals, insurance payers, basically everybody that we consider in the healthcare system are able to join Practice Greenhealth to help us with our mission to transform healthcare.
Okay, Rich, I thank you for your time.
Yeah.
I don't have anything else to ask. I mean, there's tons of stuff to talk about, but to keep this brief, keep it to that.
I will just close by saying how excited we are to have Mason General as a part of Practice Greenhealth. We've got a lot of hospitals and health systems up and down the Pacific Northwest and even into Vancouver, British Columbia that are Practice Greenhealth partners. But Mason General is the first of the Washington Rural Health Collaborative group to be at Practice Greenhealth and in our organization. We hope that some of those other hospitals will join as well, and I think they will, because we want to do our best to provide resources to help all these hospitals that are providing critical access care to their communities to be more sustainable and more efficient.